Because you guys work so much with different clinics all around the nation, yes?
uh, around the world.
Around the world.
Mhm.
Okay. Okay, man, that's going to open up a whole nother list of questions. But let's start with the US right now. Because of your exposure and how many clinics you work with in the US right now, what would you say uh, how would you describe the current dental environment in the US? Just give me a description on that.
Dentistry is the safest place to be in America today.
Dentistry is the safest.
Yeah, dental
What do you mean?
office is the safest place in terms of, in a, we've gone through a pandemic.
Oh,
Everybody is very, very concerned about infection control and staying safe. A dental office is most dental offices, if they're following protocol, are doing more to keep a safe, clean environment than any other environment in the world, including most hospitals and medical offices.
most
So,
hospitals?
most hospitals and medical offices.
Really?
Dentistry is top of the list. So, current state of dentistry, yeah, safest place to be. So, if you got any concerns about going into dental office, you're good. It is a safe place to be. Patient safety and care is top priority in almost every dental office that I know of. Okay, so that's one. Number two, technologically, there are innovations that are taking place, have taken place, and are currently underway that have made things possible today that are, when you really think about it, unbelievable. Dentists today can make teeth that look more natural than natural teeth
Yeah.
if they know what they're doing, if they
Yeah.
do it right.
Hmm.
You can have, and I know in dentistry you can't use this phrase, but a permanent replacement. Well, technically I can't say an implant is permanent. I get that, but it's a long-term replacement for your original tooth that frankly you don't have to worry that much about.
Right.
Once it's in, once it takes, it becomes part of you, and you can go on living your daily life, and you don't have to worry about it. So from a personal safety standpoint, from a clinical standpoint, from a technology standpoint, it's an exciting place to be just based on everything that is possible today.
Where's the greatest room for improvement in dentistry today?
In what's ahead, there's always a better way to do things. And one thing that is now coming to the forefront finally is the impact and relationship that good oral health has with your overall health. It's one integrated thing. It's
Amen.
it's not just the mouth, it's your mouth and your total health. And the science is compounding daily on the correlation between the two. Healthy mouth, healthy body. Uh, Unhealthy mouth, it is virtually impossible to be unhealthy here and healthy here. It almost can't happen. That the two are interrelated. So we've said for decades as non-clinicians that your mouth is the window of wellness. You look at somebody's mouth and take a look at what's going on there. It is a window into their overall health. It is key. And so for most Americans will see their dentist more often than any other healthcare practitioner, unless they have some kind of chronic condition where they have to see a specialist on a
Huh.
regular basis.
Yeah.
Most Americans will be in their dental office more than any other place in healthcare. So it becomes the front line of your total health if you're doing what you should do, to stay there, be there, and do everything you can to keep this healthy.
So you see that the greatest room for improvement, if I could summarize it, the greatest room for improvement right now in dentistry is the education side to the patients or to the clinicians or to both upon
Everybody. So
everybody.
it would be education of the patient of the correlation, conversations around that, and then coordination, so that we're having whole health discussions in the dental office and pointing patients in the right direction of here's what you need to do, here's who you need to see, in order to improve the whole health picture, not just your oral health picture.